your doctor has prescribed you Luveris 75 units as a part of your protocol. We're going to go over how to mix and prepare this medication. First, you'll have picked up this medication from your Markham Fertility dispensary. One box is one dose of 75 units. You'll need an alcohol swab, a subcutaneous needle tip, a 3 ml syringe, and a Q cap to prepare this injection. When you open up the box, you'll see inside that there are 2 vials. You'll take the vials out. There will be 1 vial with a liquid. This is a diluent. And 1 vial with a powder, a white powder. This is the medication. You'll start by taking the plastic caps off of those vials. Open up your alcohol swab and use it to clean the top of both vials. And then you'll open your Q cap. You'll put the Q cap onto the vial that has liquid in it first. Then you'll open your 3 ml syringe and twist it onto the top of the Q cap. Flip that upside down and pull back until you have about 1 ml of fluid. Then you'll twist that off and set your syringe down on something that's clean. Pull off the Q cap from the diluent vial and pop it onto the vial that has powder in it. Then you'll take your syringe with 1 ml of fluid in it, twist it onto the top of the Q cap. You'll push the fluid into the vial and swirl it around until that powder is dissolved. And you can see that white powder dissolves fairly quickly and you're left with a clear fluid again. Then you'll invert the system again and draw back until all of the fluid from the vial is down into your syringe. You can leave some air at the top so that when you twist it off, you're not losing any medication. So I've got some air. I'm going to twist off my Q cap. Next, I'm going to get a subcutaneous needle tip and I'm going to twist that onto the top of the syringe and take off the needle cap. If you have any air bubbles in your syringe, you can kind of flick them until they're gone. And then you'll push up the plunger slowly until you see a bleb of fluid at the top of that needle. Now your injection is ready. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.